So we'll
Yep.
call to order at 7:34.
Okay.
And do we have a motion to approve the minutes from last month, from February of 2023?
Carolyn makes the motion.
Okay, good. Do we have a second?
I can second. Sally Connolly.
Sally seconds. Any discussion?
All right, good.
And then all in favor?
Aye. Any opposed?
All right, so the minutes pass.
Are we good? So they're
Yep.
accepted? Okay. So reports, the director report?
Sure. So the department continues our transition to the software package Municity. This is a large transition. It'll probably take us about 6 months to just do the planning and data conversion, and then another month or so of training to get us up and familiar. But we continue to work on that.
Name?
Municity, like Municity. And so that's the a new database package that the town acquired, and it manages all the permits now for the town. So it enables online permitting, but it can also handle other issues like complaints and restaurant licensing and those types of things. So that will be what we're transitioning to. And we've continued the budget process. The department met again with the first selectwoman's office and the finance department to finalize our budget request. At the Board of Selectmen, the first selectman put forward 2 part-time positions to support school nursing for some. Jill had shared at the last meeting some increased demand that we're experiencing. So they approved 2 part-time positions to support school nursing at the Board of Selectmen, and then at the Board of Finance, we presented that information, and so they have yet to make their final vote, but we did our initial presentation on the budget, which they really didn't have any questions about our overall budget, as there were no significant changes, and there was a series of questions about the positions, and we have to provide some supplemental data for them that they requested, and so we have done that. And so we will wait until their final vote. So far, they haven't called us back to reappear or present additional information. We continue to work on our grants. Our ELC, that's the Epidemiology and Laboratory Capacity 1 grant. That was one of the first COVID grants that we got, which expired back in November. There was an opportunity to submit for a no-cost extension. We did that, and just recently we got approved to be able to utilize the remaining $30,000 in that grant ballpark, around $30,000. So we'll be using that, and that will go until the end of this calendar year. The Medical Reserve Corps RISE Award grant that we received, we continue to work on that. We have scheduled an orientation session. We're going to be having a recruitment drive and an orientation session for those new volunteers, and an appreciation evening for existing volunteers who responded to COVID. And that's going to be on May 25th this spring. And we were able to secure as our keynote speaker Dr. Matt Carter, who's the former state epidemiologist during the entire COVID pandemic and I think 35 years before that. So we're very pleased to have him come speak at the event. I think that'll be a big draw for a lot of our volunteers. We continue to respond to questions regarding the water pollution control facility odor issue. While most have accepted that it's not any kind of health concern, it still presents a nuisance odor frequently, and so the town has assigned the overarching project to the Department of Public Works to oversee, and they've actually hired a project manager to oversee sort of the day-to-day details of making sure that things are moving forward as quickly as possible. We continue to get questions and emails about different issues related to that. One of the big changes that we experienced this month, that we talked about last month, on the 16th, the state of Connecticut adopted the FDA Food Code, which is a significant change for the state of Connecticut. In the details, there's a lot of little changes. In terms of the content of what we do, in terms of inspecting and regulating food service establishments, not much has changed in terms of the science behind it. The code is similar to what we've been working with. It's just kind of new inspection forms and new unique details that we have to address. And so we've posted that information on our website about the changes. We've sent letters to all the licensed food service establishments so they're aware of the changes. We've responded to questions and emails related to that. We are in the process of sending a second letter that goes into some of the details related to that change. So some of the smaller things where just that there's new requirements on us, and I'll give one example that, there's now a requirement that on the inspection form, that a food service establishment has to have a binder that contains a protocol for cleaning up vomit accidents in the restaurant. And they have to have a cleaning kit related to that. And that's a norovirus prevention tactic or strategy. And so, but that previously wasn't required. And so, for example, this letter kind of spells that out, provides some example guidance of other policies that have been adopted by other states, and that they can copy and print out and adopt as their policy, and they need to go out and buy some supplies that upon inspection we will have to verify compliance. So that's an example, and there's several of those sort of smaller kind of changes that we want to make them aware of. And that's the second letter. And so probably this spring we'll have a series of those letters going out trying to, and the state has clearly said we're going to be in a period of transition over the next year as this now has been adopted, and it's just kind of the only way to do it really was to just do it and then work out all the kinks. And so we are not going to be, we will be gradually ramping up enforcement of these issues, but we will continue the same inspectional effort on, ensuring the establishments are compliant and safe and preparing safe foods, but we are just adding these other components, and so we won't necessarily be debiting them the first few times out if they're not aware of it, and so we'll make them aware of it and give them a chance to get in compliance. So that
I have a question. On that, does that include the food trucks and say like the facilities in town, like the skills and the assisted livings too, or is it just for restaurants that have to follow these new policies?
So it encompasses anybody that serves or sells food, and so it's restaurants, vending trucks, food stores, grocery stores. The nursing homes, insofar as we inspect the kitchens of the nursing homes, but we're not involved in the healthcare delivery. That's inspected by the state. But we will inspect the kitchens of those types of facilities, the universities, those types of things. But yes, anybody who sells and serves food in the town of Fairfield, and there's, I should say almost everybody. There's a couple nuances, with state regulations in terms of cottage food industries, where people, sell non-perishable foods or prepare non-perishable foods in their homes. That's currently not licensed. They're allowed to continue with that, when that doesn't fall under this. And like small home daycares continue to not fall under us that prepare food for the children that are there. So there's a few establishments like that didn't fall under it and still won't fall under it. But everybody that we currently license will fall under it, with the exception of a very few facilities that don't sell any perishable foods, just prepackaged foods. Those will no longer require a license. So that's a change in the FDA food code. So, for example, we inspect Marshalls and TJ Maxx because they have food on their shelves that they sell. Currently, in the past, we had licensed them. Going forward, they will no longer be required to be licensed, as an example.
Oh, okay.
License. Any other questions?
No, I'm good, thank you.
Okay, so we'll continue to work on that. Later on the agenda, we have the proposed changes to the to our regulations to enact those state regulations locally, and we'll talk more about that later. We did order, the federal government offered an opportunity to order more COVID test kits from federal supplies, so we ordered, and these are with later expiration dates, sort of the traditional, further out expiration dates, not like they were trying to clear their warehouses out of old kits. These are newer kits, and so we ordered an additional 5,000 of those that we'll have available to distribute to community members and community organizations and town bodies. And so we haven't received those yet, but we've placed an order for those. And we did, the health department was involved in offering a psychological first aid class to the CERT team. Did that training last Saturday, and then I had the opportunity to go today to the launch announcement up in Hartford at the Capitol building to launch the survey of the Connecticut Wellbeing Index, which is a survey that our health department and lots of health departments throughout the state and hospitals and the Community Foundation, the Fairfield County Foundation, and several foundations support it. And so this is one of the largest surveys done in the state, and it provides great information for us and serves as one of the pillars of our community health assessment. And so I was able to go up and be a part of that announcement of the launching of that and meet with Senator Wang today to discuss that. And that is my report. And Mary Frances, tonight, as the second report, we have Dr. Santina Duranco here to give a report for the community health program.
Oh, great.
All right, let's get started. So just a quick update with COVID. Our cases have drastically decreased. We're averaging probably about 5 cases a day. When, we're still making the calls, we make 2 attempts, and people still seem to be pretty responsive. So we are continuing that. The COVID team is also working on an infectious disease policy for internal. And so they collected all of the reportable diseases that the state collects and that gets reported to us, and kind of fishing through which ones we act on, which ones we work with the state, which ones we just look at for monitoring. So it's a pretty extensive policy that they're working on. It's really for our internal, anyone that any new hires and things like that. We attended the Health and Fitness Expo hosted by the Chamber of Commerce this weekend. We saw about 150 people. We handed out COVID tests, thermometers, pulse ox, information on lead, breastfeeding materials. We had bike reflectors and pedestrian reflectors, as well as information on the MRC. And so they said it was really successful. In the month of February, for Heart Health Month, every Wednesday from 10 to 1, people can come by the health department and get the Know Your Number screening. So we did height and weight for BMI, we did blood pressure, we did A1C, and it was really successful. We saw about 15 people. And so some of the preliminary internal discussions we're having is maybe making this a monthly service. So whatever it may be, the first Wednesday of the month, people can call and make an appointment, and we can do that screening. But again, that's just, very, very premature at this point. We have the Healthy Lifestyles program. We have 12 people enrolled in that. It started back in February, so we're entering week 4. So this is where we just encourage people to make healthy lifestyle changes. It's not a diet program or anything like that, but one of our metrics is we do weigh people in, and so far in the 4 weeks, they've lost collectively about 31 pounds. So it's been really good so far. With our Region 1 partners, we've done a series of mental health webinars. So back in January, we did a mental health webinar for the general public. Just last week, I think it was, we did one focused on adolescents and families. And then on May 4th, we're going to have one geared towards the senior population. And the town has been hosting these webinars for our Region 1 partners. And on May 4th, it will be held at the Senior Center, and there's both in-person and Zoom options. And those have both been really well attended. We've had about 60 people attend both sessions. And the cool thing is we're able to record them on Zoom, so we're able to give them to Fair TV. So they've been airing it on Fair TV. I think Trumbull has also been airing it, and Darien on their government channels. And then I am a Matter Balance. So Matter Balance is our fear of falling prevention program for seniors, and I am a master trainer. And this week, on Thursday and Friday, I will be training other towns this way they can offer the program. So Aspetuck is coming, New Canaan, Cheshire, Trumbull, Norwalk, and someone else, and I can't remember. But 14 of my fellow colleagues are coming for the 2-day training so that they can offer the program to them. And that's really it.
Okay. Mary Frances, the next thing on the agenda is communications, which I have none.
None? Okay. Any old business?
Old business. So we do have old business. In the handouts that I emailed, we have a suggested motion that I am requesting, and this is the. So we shared last month, and I shared in my report that the FDA Food Code is now in effect in the state of Connecticut. And so what this motion does is essentially deletes all the sections of the Fairfield Public Health Code, which is under the authority of the Board of Health to make changes to. And so it deletes all the sections related to food. So, Section 14 is related to having a qualified food operator, somebody who's taken an exam on food safety in every restaurant. Section 15 was restaurants. Section 16 was retail food stores. Section 20 was itinerant vendors, and 21 was, or 21 and 22, one was vendors and one is caterers. And so now that is all compiled into the food code, and so what we're doing in this motion here under old business is to essentially delete our codes, replace them with a new Section 15. That will be the sole code for regulating food establishments in the town. It defines a food establishment in 15.1. In 15.2, it adopts the FDA Food Code by reference, which is a style of adopting the FDA Food Code that the state utilized in their regulations. It's a recommended model in the FDA Food Code itself, so it's essentially saying we are adopting by reference the FDA Food Code. Section 15.3 just talks about every establishment in the town must obtain a license from the Director of Health. 15.4, and these are local sections that just enable us locally to do a few things similar to what the state has put into place that enables them to do a few things. 15.4 is our fee schedule, and so it enables us to charge a fee in accordance with the fee schedule for food service establishments. It adds we currently have a late fee of $100 if somebody doesn't pay by the due date licenses are currently due on February 1st. If they don't pay, they have to pay a $100 late fee. One slight change here is we're adding, if they don't pay by March 1st, that goes up an additional $100, and so it's a $200 late fee if they don't pay. And so that's an ongoing struggle that we have have had over the years of people not paying their license fee on time. And so a couple years back, we instituted a $100 fine, and we're trying to up that a little bit to get a little bit more compliance and have that additional $100 fine for the second month that they don't pay. And then the last one just talks about 15.5, the new 15.5 section talks about enabling for restaurants that apply August 1st or after, so in the second half of our year, since our licensing starts February 1st, the second half of the year, if they apply for a new license or a new owner applies for an existing establishment, that will only charge half the fee. So we're trying to be reasonable. That wasn't in our code before, and so we wanted to offer that as a current allowance to say, yep, you pay if you apply in the second half of the year, you pay half the license fee. And so those are the changes, and I would request that the motion, the language is there, and if somebody again would like to waive you may say, well, I'm going to read the motion and waive the reading of the body of it, and note that it's in the minutes and the attached materials. So that's what I'm requesting under old business, is that motion to be made.
So I'll move to, this is Jason, I'll move to accept the recommended changes to the code as presented and referenced in the minutes.
There need to be a second?
It's Sally. I'll second.
Okay. And then is there any discussion about this? Anybody have any questions about the changes?
Just to be clear, the following section is going to be new business we're going to discuss further, right? So I do have a question under that.
There's
the second page?
Okay. Yeah, the second page is new business. Yep.
Okay.
No other questions? Okay. Sally, Mary Frances, you would call for the vote?
Yep. All those in favor say aye.
Aye.
Right.
Any opposed? No, then it is passed as written, as Sam's directed. Sorry, I don't have it in front of me, so as you said, going forward.
Okay. All right, so that motion passes unanimously. And then the next item on the business, Mary Frances, is new business.
New business, yes. Any new business, Sam? And
yes, we do. We have another motion, and this is this motion is I'm requesting a motion to make the following changes to Section 1.7 of the Fairfield Public Health Code, pursuant to recent changes in the regulations of the state of Connecticut. So these are additional changes that have been recently made, and then there's one other a slight change that we've already discussed, but I'll go through that. So the 1.7 is just our fee schedule, and so what we are adding. A couple months ago, we talked about the itinerant vendor memorandum of understanding agreement between towns. That creates this unique loophole where it says itinerant vendors, so food trucks that are licensed in other towns that want to vend on our streets can do so without having to obtain a license from us. They need to let us know they're in town. We can inspect them. We can shut them down if we have to, but they don't have to pay us a license fee and go through that administrative struggle. The memorandum of understanding exempts those food trucks that operate at temporary events. So if there's a food truck day, that memorandum of understanding, their license would not cover them. They'd have to obtain a temporary event license from us. So that's the loophole that the state put in there. So what we're doing, just because a lot of our vendors, itinerant food truck vendors, come from multiple events. And so what we'd like to establish and add to our new category of license under the first bullet is a multi-temporary event itinerant vendor license that would be the same as the itinerant vendor fee, which I believe is $343. So that itinerant vendor fee that we currently charge would only be for those who are from our town, that their trucks are based in our town, and then the other fee would be for those coming and they want to do multiple temporary events. They can pay the same fee as the people in town, and they can operate at those multiple events. And they can operate on our streets as well because of the MOU. So that's the first bullet. The change, the new food code calls what used to be called a qualified food operator is now called a certified food protection manager. So we're changing that in the fee schedule. We deleted the section 14, which talked all about qualified food operators. Now we're just changing it in the fee schedule. The third bullet talks about changing the titles of, we currently have 2 license categories for traditional food service establishments, a low risk and a high risk. To be consistent with the food code, we are changing those to a food establishment with prepackaged temperature control for safety foods, and then the high risk would become a food establishment with prepared temperature controls for safety foods. So it's consistent with the FDA food code language that talks about certain classes are this type and certain classes are that type. And so we're adding that into changing those license categories to be consistent. And then the last, we're eliminating the reinspection fee because we currently had the system worked where if you scored an 80 or below, you would have a reinspection. If you failed that reinspection, then we would charge a reinspection fee for those inspections. So we never traditionally even charge that because most of them complied by the first inspection. They would comply with that. And so the new food code changes it so there are no failures, and that the types of debits or violations that we would mark each have their own correction time frame. And so higher risk types of items called priority debits would have a 72-hour correction time period. Items that are sort of the traditional marks are not called priority foundation, which are just a little bit less serious violations, would have a 10-day requirement reinspection time frame, and then traditional marks like if they weren't wearing a hairnet, things like that, that would go to a 90-day correction. And so we didn't want to, with the current code, we didn't want to charge reinspection fees for all 3 of those. We felt like it would be unfair, and it's a transition period. So we talked about it, and we felt like, let's just eliminate it for now. We may talk about bringing back some kind of, if we get a non-compliant situation, we may bring it back. But what the food code allows for is to demonstrate compliance with those corrections. We don't necessarily have to go back out. So if it's this thing is broken, needs to be repaired, they can simply submit a picture to us. We attach that to the file, and we say that, okay, they corrected the broken tile, done. And so we don't necessarily have to go back out, so it's not really like taking hours of somebody's time to do a reinspection. So we felt like, let's eliminate the reinspection fee. So that's that second to last bullet, and the last bullet is adding the $200 late fee for the additional month that they didn't pay their license by. So I would ask for a motion to be made, and the language there is at the top of that description there. And again, if you want to waive reading, that's fine as well.
Do we have a motion? Anyone, can I motion it to accept it, or?
I'll make the motion. Sorry, I thought you were...
No, I don't feel qualified to make a motion on that particular thing.
Okay.
So, no, I move to accept the additions to the code as presented.
Okay. Do we have a second?
I'll second it.
Okay. Any discussion? You said you had a question?
I think you mostly answered it, but just to clarify, so it sounds like the reinspection fee elimination won't have a fiscal impact on your budget then? No,
we traditionally didn't charge it. We would, we try to be flexible, and if there was, the only time that in the past where things like that happened, where, they didn't comply in that time period, they said, well, we ordered like the part, but we can't get, we can't get a new fridge right here in 2 weeks, and so we'd say, well, show us that you ordered it, take this one out of commission, sort of reorganize your storage. And so that's the time where that they weren't able to make the corrections in 2 weeks. Typically, was things on back order, and that's even become worse with COVID. But we just most of the time we gave them 2 weeks, and they complied within 2 weeks. So we really, we were talking about when was the last time we ever charged it, and I think it was probably about 10 years ago. Yeah. So, no fiscal impact.
Great.
So, Mary Frances?
I just had,
Sure.
Sorry, it's Sally Connolly again. I think that sounds like a really good idea, having the multi-event license, obviously, because, you don't want it to be so cost prohibitive for some of the vendors. But just one thing, I'm not sure if I misunderstood, but what did you say about just currently people from other towns who can come in and just on a regular day, like not for an event, anyone can just come in and have the truck on the street? I kind of missed that.
Yeah. So, and again, I think we talked about this a couple months back, and so there's this a few years back they passed a law at the state level that said the Department of Public Health shall put in place a mechanism for itinerant vendors to obtain one license that shall be good across town boundaries.
Okay, got it.
Department of Public Health. So you
just basically check, okay, because I do remember the meeting. I just wanted to clarify. So obviously, if you just happen to swing by and check on that, you just know that their license is in existence from another town.
Exactly.
Okay,
and
that's all. So I don't want to hold it up the meeting at all, but I just want to make sure that I understood. So
yeah,
I was just going to say my questions have been answered, and I'm on board with the that adjustment that you made. Sounds like a very good call to make things easier for everyone.
Great. Thank you, Sally.
Okay. So actually, how far did we get then with Robert's rules?
So we have the first and second. We had a discussion. Yep, we have the first and second in the discussion. And so now we would call for a vote unless there is any other questions.
No other questions? Can we call for a vote? All in favor?
Aye.
Aye. Any opposed? No? Okay, the motion's passed. Stan?
Okay. Well, that is our entire agenda. We can call for a motion to adjourn unless there's any other discussion. All right.
No, good. Okay. We have a motion to adjourn?
All right.
Seconded.
All right. Thank you, everybody. Appreciate that.
All right. Thank you, Mary Frances. All right. So the meeting ends at 8:06. All right.
All right. Thank you so much.
Thank you, everyone.
Thanks.
And I'm gonna stop the recording.
See you next month.
All right.
Bye.
Take care.
Bye.
And Gina, did you have any questions?
Nope. I'm all set. Thank you.
Okay. Thank you.
Have a great night, guys.